Hello. Today we will be discussing medications for the heart. The objectives of today's presentation will be to discuss the do's and don'ts of taking your medications to help provide you a better understanding of the uses and common side effects of heart medications and to know what you should be discussing with your doctor. Just so you know, this presentation is intended for informational purposes only and is not all-inclusive, nor should it be interpreted as medical advice. You should consult a qualified healthcare provider before making any decisions about your therapies and/or health conditions. So, what are the do's of taking medications? Make sure you do know about your medications, their name, what they're used for, etc. Do take your medications as prescribed. Do refill your medications before they run out. And definitely do keep an updated list of your medications with you at all times. The don'ts of taking medications are as follows. Don't stop taking your medications without talking to your doctor. Don't hesitate to make sure you have the correct medications filled by your pharmacy. And definitely don't share your medications with others. Some common medical terminology you may hear during this presentation about your heart medications are time release, IR or immediate release, SR or sustained release, and ER/XL or extended release, OTC or over-the-counter, angina, which is chest pain due to poor blood flow through the vessels of the heart, and arrhythmia is another name for an abnormal heartbeat. Let's take a look at these topics a little more in depth. Cholesterol medications. Cholesterol is a fat-like substance found in the cells of your body. It is used to build cells and to make certain hormones. Your body makes cholesterol, but it also comes from the foods you eat. When your cholesterol is high, it can cause the formation of fatty deposits known as plaques in your blood vessels. There are several types of cholesterol. LDL, or low-density lipoprotein, which is considered the bad cholesterol. HDL, or high-density lipoprotein, which is considered good cholesterol. And then there's total cholesterol. Triglycerides are a type of fat in your blood. They help to store fat that your body uses for energy, but too many can cause hardening of arteries or thickening of arterial walls. When this happens, it can increase a person's risk for heart disease, heart attack, and stroke. Statins are a class of medication that help decrease cholesterol production and provide some anti-inflammatory effects on the blood vessels. They work to lower total cholesterol and LDL, the bad cholesterol, and help increase HDL, the good cholesterol, and lower your triglyceride level. Here are some examples of the more common statins prescribed. Some common side effects seen with statins are muscle pain, tenderness, stiffness, cramps, weakness or fatigue, usually found in the larger muscles of the body, such as the thigh, and typically occur within 4 to 6 weeks after starting the medication. Some more severe side effects of statins are muscle injury and liver damage. Bile acid binders, or the resins, work to decrease LDL reabsorption in the intestines and may increase triglycerides. An example of a bile acid binder is cholestyramine or Questran. Possible side effects you may experience while taking a bile acid binder are belly pain, bloating or gas, constipation, and nausea. It's important to note that these medications may interfere with other medications you are taking, such as warfarin, digoxin, thyroid products, or thiazide diuretics. Make sure to take your medications 1 hour before or 4 hours after taking a bile acid binder to avoid any drug-drug interactions. Nicotinic acid, or niacin, can be used to increase HDL and lower triglycerides and LDL. There are immediate release, sustained release, and extended release niacin products available. Possible side effects when taking niacin are flushing, dizziness, and palpitations. Niacin may also increase fasting blood sugar and may increase gout symptoms. Fibrates are another type of cholesterol medication that work to lower triglycerides and increase HDL. Side effects seen with fibrates are indigestion, muscle pain, and possible gallstone formation. There are also cholesterol absorption inhibitors that decrease the absorption of cholesterol in the intestines. This leads to a decrease in cholesterol storage and increases the clearance of cholesterol from the blood. These medications help to decrease LDL and triglycerides and increase HDL. Ezetimibe, or Zetia, is the medication available from this class. The most common side effects are muscle pain and weakness. Now let's move on to blood pressure medications. One class of blood pressure medications is beta blockers. They are responsible for decreasing heart rate, strength of contractions, and blood pressure. Here's a list of available beta blockers on the market today. Beta blockers may be prescribed for high blood pressure, abnormal heart rhythm, heart failure, angina, or for secondary heart attack prevention. Possible side effects that you may experience when taking a beta blocker are dizziness, low heart rate, stomach upset, trouble sleeping, and sexual dysfunction. They may also hide symptoms of a low blood sugar. Another class of blood pressure medications is nitrates. They work by relaxing and widening the blood vessels around the heart and throughout the body and increase oxygen supply to the heart. The following is a list of common nitrates that are prescribed. Nitrates may be prescribed for patients with angina, heart failure, and/or high blood pressure. Some possible side effects of nitrates are headache, flushing, low blood pressure, and dizziness. Some nitrates can be taken under the tongue and may cause bad breath. The angiotensin-converting enzyme inhibitors, also known as ACE inhibitors, are another class of medications used to treat high blood pressure and may be used in heart failure. Let's talk a little bit about how they work. As shown on the diagram on this slide, your kidneys are responsible for detecting drops in blood pressure. When this happens, your kidneys release a substance called renin. The angiotensin-converting enzyme inhibitors, also known as ACE inhibitors, are another class of medications used to treat high blood pressure and may be used in heart failure. Let's talk a little about how they work. As shown on the diagram on this slide, your kidneys are responsible for detecting drops in blood pressure. When this happens, your kidneys release a substance called renin. Renin then activates a pathway for production of angiotensin II, which raises blood pressure. The ACE inhibitors block this process from occurring and in turn lower your blood pressure. Here on this slide are examples of ACE inhibitors. Some common side effects associated with ACE inhibitors are low blood pressure, dizziness or weakness, high potassium, dry cough, angioedema, which is severe swelling of the lips and face. Another class of heart medications is the angiotensin II receptor blockers, or ARBs. They're similar to ACE inhibitors in that they also block a pathway that prevents angiotensin II from being produced, therefore lowering your blood pressure. They are used to treat high blood pressure and may be used in heart failure. Here are some examples of commonly prescribed ARBs. Some common side effects of ARBs are low blood pressure, dizziness or weakness, high potassium levels, as well as a dry cough. Let's also talk a bit about Entresto, which is a new combination medication of valsartan and sacubitril. It's indicated for patients with heart failure. Entresto is not to be taken if you're already on an ACE inhibitor or an ARB. The ACE inhibitor or ARB should be stopped first prior to starting Entresto. Entresto is given twice daily and has similar side effects to the ACE inhibitors and ARBs, but with an increased risk of causing your blood pressure to dip too low. Another class of heart medications is calcium channel blockers. They are responsible for blocking calcium from entering vascular smooth muscle, which leads to widening of blood vessels and smooth muscle relaxation, which in turn lowers your blood pressure. Here's a list of commonly prescribed calcium channel blockers. Calcium channel blockers are used to treat high blood pressure, angina, and abnormal heart rhythms. Some common side effects are headache, low blood pressure, dizziness or lightheadedness, and swelling of the arms and legs. Diuretics, also known as water or fluid pills, are also used to treat high blood pressure. They work by removing extra fluid from your body, which then lowers blood pressure. Some examples of the commonly prescribed diuretics are furosemide or Lasix and hydrochlorothiazide, or known as HCTZ. Some common side effects that may be seen when taking a diuretic are frequent urination, leg cramping, dizziness, and headaches. Now let's take a minute to talk about a cardiac glycoside called digoxin. Digoxin helps your heart to pump better, which then increases blood flow in the body. It also helps slow your heart rate down. Digoxin is indicated for use in heart failure and atrial fibrillation, also known as AFib. Some common side effects of taking digoxin are stomach upset, loss of appetite, fatigue, palpitations, and colored vision, where an individual may see green or yellow halos around lights. There are several medications that help prevent blood clots. Let's first talk about antiplatelet agents. Antiplatelet agents help to decrease the clumping together of platelets, which in turn helps prevent the formation of blood clots. Here are some examples of commonly prescribed antiplatelet agents. Antiplatelet agents may be prescribed if you've had a cardiovascular event, a stroke, cardiac bypass surgery, cardiac stent placement, or certain forms of heart disease. All antiplatelet agents have the potential to cause bleeding and bruising. Some antiplatelets may cause stomach upset, such as aspirin. Agrinox may cause headache. Effient has a higher bleeding risk depending on your age, weight, and stroke history. Other medications that prevent blood clots are anticoagulants. Anticoagulants help block clotting factors to prevent blood clots from forming or growing. Listed on this slide are examples of anticoagulants commonly prescribed. Anticoagulants are prescribed to prevent blood clots in patients with atrial fibrillation, mechanical prosthetic valves, and clotting disorders. They're also used to treat existing blood clots in patients who have had an embolic stroke or a clot in the brain, a heart attack, a pulmonary embolism, also known as PE, which is a clot in the lungs, or a deep vein thrombosis, DVT, or clot in the large veins of the body. With any of the anticoagulants, there's always a risk for bleeding and bruising. More serious side effects may occur, such as blood in your stool or urine or vomit that looks like coffee grounds. Be sure to contact your doctor should this occur. We can't discuss heart medications without discussing herbal supplements, as there are several that have shown to have heart-healthy benefits, and for this reason, they might be prescribed by your doctor. Many of these supplements can be purchased over the counter. Some OTC products can interact with prescription medications you may be taking, so be sure to talk with your doctor before you start taking any over-the-counter products. Remember, herbal supplements are not regulated by the FDA. They may have differing amounts of the active ingredient. Products marked with a USP emblem, as shown on this slide, indicates that the product has been evaluated for identity, strength, and purity. Fish oil or omega-3 fatty acids are often prescribed to help reduce the risk of death from heart disease and to help lower triglycerides. They may cause stomach upset as well as cause a fishy taste in the mouth or a fishy burp. To reduce these side effects, you may want to take these with meals, freeze the capsules, take a different formulation, or divide your total daily dose. Omega-3 fatty acids can also be found in the foods listed here. If your doctor has asked you to increase your intake of omega-3 fatty acids, try and incorporate more of these oils and foods into your diet. Red yeast rice may also be recommended as it may have the ability to lower cholesterol, but be mindful, not all strains of red yeast rice are the same. Coenzyme Q10 is a vitamin-like substance found in heart, liver, and kidney cells. It is an antioxidant used to help with muscle pain and heart failure. The most common side effect is stomach upset. It is important to talk with your doctor or pharmacist about your medications. What should you discuss? Medication and food allergies, how to take your medication, any side effects to expect or that you may be experiencing, any difficulties taking or obtaining your medications, any OTC medications or herbal supplements you take, and of course, any other questions that you may have.